Thank you, Commissioner, and Governor as well. This is a critical effort, and we want all Rhode Islanders to know the strength of the team that's working to do what's best for all of you, so that you can also make the decisions to do what's best as well. To get started with the cases, briefly, we have 61 new cases to report today. We have 74 people currently hospitalized. 12 people are in an intensive care unit, and 6 of those 12 are on a ventilator. Sadly, we have 2 additional COVID-19 associated fatalities to report. 1 person was in their 80s and 1 person was in their 90s. Our sympathies and our prayers are with the families of these beloved Rhode Islanders. It's important for us to acknowledge that, because while our number of 61 cases today is a little lower than what we've seen over the last week, we are not out of the woods. It's critical for you to heed what the governor shared about the cases and what we are seeing. There is too much transmission going on right now, particularly tied to the social gatherings. We are addressing social gatherings at bars and restaurants where people are congregating together, not wearing masks through the compliance orders that have been released. We need to address the social gatherings that you are attending, ensuring that people are wearing masks, even when it is family and loved ones. Transmission can occur when you're close together and you're not using the protective measures that we're talking about. Wearing masks is critical. Wearing masks is key. Backyard gatherings like barbecues, informal gatherings with families and friends, day trips, family celebrations where high-touch objects like serving utensils are being used. These are all examples of the scenarios that we are seeing cases increase and transmission occurring. And as the governor has shared, this is all preventable. We need people to wear masks, wear them appropriately over their nose and over their mouth. Too many people have told us that they could have done better in terms of wearing masks when we are reaching out to them about a new case that they have caused or been exposed to. And too many young people are identifying multiple close contacts. We need you, the 20-year-olds, the 30-year-olds, to heed what we are saying. Every activity, every gathering that you're attending with crowds, without masks, is impacting all of the work that we are doing painstakingly to make sure that people can return to work safely, can make sure that people can return to school where they need it safely. We need everyone to understand their responsibility. When you're at a party and it's feeling good and you're engaging with people that aren't wearing masks, everyone feels healthy and seems fine. That is exactly how COVID is transmitted. And it may take 2 or 3 weeks before it's known. At that point, it is too late. So we want to make sure that you hear us in understanding how critical this is. We are keeping our eyes focused on the prize with the governor's leadership and with the excellent commissioner and the RIDE team's work and leadership. Our focus is on being able to reopen the economy safely and to get children and people back into school and learning safely. But we can only do it with your contribution. I'm going to finish with, again, thanking the members of our expert team of advisors. Each of them have served as mentors to me, have been extremely valuable and critical throughout this entire response, and now are providing additional input on what we can do strategically and thoughtfully and carefully to advance reopening K through 12 and all that we need to across the education sector. So thank you to Dr. Dennehy, thank you to Dr. Mermel, thank you to Dr. Sharfstein, thank you to Dr. Weddle, thank you to Dr. Jha. We've also been welcoming and inviting additional experts from South Korea who joined with us yesterday from Connecticut, from Maryland, other parts of the country. Rhode Islanders can know that we are being as systematic as we can to rely on the data and the science to move forward. Join with us to keep our eyes focused on the prize.